Hi everyone, this is the third trimester video. So third trimester, you start feeling not so good. By the end of the third trimester, I was feeling huge and did not want to do anything. So definitely, if you're going to be going out and doing things, plan it for the beginning of your third trimester if you can. If you haven't registered yet, do it right at the beginning of your third trimester. Some of the things that we did, we started our classes in the third trimester, and we took several different classes. We took two that were offered by the hospital, and they were really cheap. It was like $20 for both my husband and I to attend. One of them was broken into like nightly classes once a week for a month. And then another one was like an all-day weekend class. Honestly, it's up to you which makes sense if they offer it from your hospital. I would recommend if your hospital offers those type of classes, go ahead and take them, even if you're taking another class. They're usually cheap, and they give you really specific information about how the hospital handles things, which can be really helpful. If you go to a more generic class that's offered in your area, they may not know the particular policy at the hospital you're going to give birth at. We also took a natural childbirth class because we wanted something very specific. We wanted sort of a Lamaze type class. Check with your doula if you have one. You can search online for pregnancy classes in your area. You can check with your doctor. There's different places you can check to get information. I would recommend a natural childbirth class if you can afford it. It wasn't too expensive. It was maybe like $150. I don't remember exactly. And it was kind of like one night a week for a month kind of a situation. It was a very intimate setting. It was, there was only, I think, one other couple in our class. So we could really ask a lot of questions and, had a lot of one-on-one time with the doula who was teaching the class. And it gave us a really good perspective. It really gave us that natural childbirth perspective. And then when we had the hospital classes, it gave us the hospital perspective. And in fact, with the two classes we took at the hospital, one was more natural childbirth, one was less so, and in different ways. So we really got a very broad range of opinions and information. So we really felt like we were armored well to make decisions when the time came. Often with the hospital classes, you'll also get a tour. If you're not going to do the hospital class, definitely go do your hospital tour. It's very, especially if it's your first child, or if it's the first time you're giving birth at that hospital even, just to see what the room looks like, what kind of features, I guess, that they have. For example, my hospital had like a birthing bar as an option, but they did not have any birthing balls or water births. So if those are things I was interested in, I would have to either provide it for myself or just know that wouldn't be an option during labor. So certainly it's helpful also in creating your birth plan, which I would also recommend, is to have a birth plan. Now, oftentimes with birth plans, it does not go exactly as you want it to go. What in life does? Really. Mine certainly did not. But I think the birth plan, for me, the most helpful part of that was in creating it and at looking at different templates of birth plans. I learned about procedures and different things that I wasn't familiar with even after my classes. And it got me to asking my doula, what does that mean? And my doula helped me with my birth plan. So what I did is I created one, and then she read through it and said, okay, this doesn't make sense. or do you know what that is, and that kind of thing. And I would ask her, I said yes to this, but I don't really know what that is. It sounds like something I would want, but I don't know. So it was really, really helpful in helping me understand the whole birthing process and all the different aspects that would go into it, and then really laying down what I wanted for my birth. Check and see if your hospital has I think it was called like a hospital coordinator, but it was specific to the women's, specific to childbirth, I believe. And her role was basically to make sure that my birth went the best way it could. And so I was able to send her my birth plan ahead of time, and I gotta say, it was followed to a T as far as it could by the hospital when I came in. So they did a really great job. I don't know if that was just because of the hospital or because I had sent in the birth plan in advance. You can also bring your birth plan into your, to have your doctor read it. That's super important. And if you have multiple doctors that could be on call, and you're seeing different doctors each visit, go ahead and start somewhere in your third trimester going over those birth plans with the various doctors that you're visiting, so you can make sure that they're all on the same page with you. And if there's anything that they don't feel comfortable with, you can discuss it with them, and potentially at that point you may want to make a decision to move to a different doctor depending on the situation. But I know that a lot of women, when they finally bring up their birth plan, that's when they realize that the doctor they chose isn't really the best doctor for them. So don't wait till the very last minute to show them your birth plan. Start in the third trimester. Okay. Vaccines. For some reason, I was not really in the loop on the whole TDAP thing. That's your tetanus, diphtheria, pertussis vaccine. We get those all as children, and I think now they are revaccinating on the pertussis, and of course the tetanus shot you're supposed to get every 10 years, but the tetanus shot does not include the pertussis vaccine, at least when I last had it. So I hadn't had pertussis since I was a baby, and because pertussis is whooping cough, and it has made sort of a comeback in the last decade or so. I believe because some parents were not vaccinating their children with pertussis. So they recommend that, I believe during your third trimester, you get the TDAP vaccine so that you can inoculate your baby through the placenta. I was not aware of that, and it was not made very clear to me, unfortunately, by my doctor. So I had to get it as soon as I found out, basically, after she was born. And then it was just a matter of protecting her because I was vaccinated and trying to keep all the people around her vaccinated. It's better if she can get that through me when I was pregnant. So definitely ask about the TDAP from your doctor. A flu vaccine, if you haven't had a flu, I think even if you had a flu vaccine that year, it's still a good idea, if you're going into the flu season, to go ahead and get that when you're pregnant too. But ask your doctor. Best resource you've got. Another thing I'm not going to talk about too much is the Group B Strep. That's another test that they will give you that could potentially result in interventions during your labor and delivery. There's a lot of information online about how you can make that test negative by doing different things. I was going to do some of those things, and then I decided, well, I took vitamin C. I did take vitamin C to try and stave off the Group B Strep. There were other things I could have done. I didn't do at the last minute because there's different things with garlic that you can do to keep that infection away. I had a real aversion to garlic throughout my whole pregnancy, so I decided at the last minute not to do it. I was also a little concerned about, the concern is that if you have this Group B Strep infection, that you could pass it along to your baby and it could be potentially life-threatening. The chances of that happening are very small, but because if the baby did end up getting it, chances are very high that something bad could happen to the baby. They want you to take this test, and then they give you antibiotics during labor and delivery if you're at risk. So there's some people that say you can use garlic in different ways to get rid of the infection. Because my baby's life was hanging in the balance there, I decided not to try and mess with that test. I just didn't feel comfortable with it. Totally up to you what you want to do, but I did want to mention that that is a test that you will get in the 3rd trimester. So stay tuned to the delivery and the 4th trimester.